The dying man in room 447 had kind eyes. That's what Elena noticed first, not the expensive watch on his wrist or the private suite. He occupied, but the way he smiled, at her despite the pain, etching lines across his weathered face. She was 26, drowning in student loans, working double shifts at Mercy, General, while her mother's chemotherapy. Bills piled up like accusations on her kitchen counter. Her scrubs were faded. Her shoes had holes she'd covered with duct tape, and some nights she chose between eating dinner or taking the bus home. But when she entered Thomas Whitmore's room that cold October evening, she smiled as if her world wasn't crumbling. "You look tired," he said, his voice barely above a whisper. Stage 4 pancreatic cancer had reduced him to a shadow, but his observation struck her as oddly intimate. Patients rarely noticed their nurses as human beings. "I'm fine, Mr. Whitmore." Elena adjusted his IV with practiced efficiency, checking the morphine drip that kept his pain manageable. "How are you feeling today?" Honest answer, "Like I'm dying." A weak laugh escaped him. "But you already knew that." She should have offered platitudes, something about staying positive, about miracles. Instead, she pulled up a chair. Her supervisor would have reprimanded her for wasting time, but something about this man's directness demanded equal honesty. "Then let's make today count," she said simply. That's how it started. 10-minute conversations stretched into hour-long exchanges during her breaks. Thomas told her about his late wife, Catherine, who died 3 years earlier, about his estrangement from distant relatives, who'd only started calling when his diagnosis went public, about his regret for spending decades building an empire while neglecting to build a family. Elena shared, too, about her mother's diagnosis, about the impossibility of medical bills on a nurse's salary, about her dream of opening a free clinic in her underserved neighborhood. She never asked why he was alone in a hospital room. Why no family visited? Why a man who could clearly afford the best care stayed at their modest public hospital. "You have a rare gift," Thomas said one evening 6 weeks into his stay. "You see people really see them, not what they own or what they're worth, who they are." Elena squeezed his hand. It felt fragile as bird bones. "Everyone deserves to be seen, Mr. Whitmore." "Thomas," he corrected gently. "And I have a strange request." The proposal came 3 days later, delivered with characteristic bluntness. "Marry me." Elena nearly dropped the medication tray. "I what?" "I'm serious." Thomas struggled to sit up straighter. "I have perhaps 2 months left. I have no children, no close family, and relatives circling like vultures. I've rewritten my will. But lawyers are parasites. They'll tear it apart, tie everything up in probate for years. But a spouse," he paused, catching his breath, "a spouse has protections rights that can't be contested. Mr. Whitmore, Thomas, I can't marry you for money. I'm not offering you money." His eyes held that same kindness she'd first noticed. "I'm offering you the chance to continue your work, to save others the way you've—" His voice cracked. "The way you've made my dying bearable. You've given me more humanity in these weeks than I've known in decades." Elena's hands trembled. "I don't understand." "Marry me. When I'm gone, use whatever I leave behind to build that clinic. Help your mother. Help others. I'm not asking you to love me. I'm asking you to let me do one meaningful thing before I die." She should have said no. It was absurd, potentially illegal, definitely crazy. But when she looked at this dying man who'd become her friend, who asked for nothing, but gave her genuine conversation and respect, something her 70-hour weeks rarely afforded, she found herself whispering, "Okay." They married in his hospital room on a Thursday morning. The chaplain seemed confused. The witness, another nurse, looked scandalized. But Thomas squeezed Elena's hand with surprising strength when they exchanged simple silver bands. "Thank you," he breathed, "for making me feel human again." He died 17 days later, Elena holding his hand, reading him poetry he'd requested. His last words were, "You'll do remarkable things." The grief surprised her. She'd known him barely 3 months, yet tears soaked her pillow for weeks. She'd lost a friend, perhaps the only person in years who'd truly listened to her. The lawyers came on a gray November afternoon. 3 men in suits that cost more than her annual salary, expressions ranging from curious to hostile. Mrs. Whitmore, the eldest, began, and Elena flinched at the unfamiliar name. "I'm Jonathan Pierce, senior counsel for the Whitmore estate. We need to discuss your late husband's holdings. I don't want to contest anything, Elena said quickly. If his family needs. You misunderstand, Pierce opened a leather folder. Thomas Whitmore was the principal owner of Health Corp International, 17 hospitals across 6 states, including Mercy General, where you currently work. His personal net worth at time of death was approximately $3.2 billion. The room tilted. No, there's been a mistake. No mistake. He left everything to you. The hospitals, the foundation, the investment portfolio, all of it. He made his instructions very clear. Pierce slid documents across the table. He wanted you to continue operating the hospitals as affordable care facilities. He wanted you to establish free clinics in underserved communities. He left detailed notes about your conversations, your dreams, your mother's situation. Elena couldn't breathe. He was testing me. All those weeks he was testing me. No, Pierce's expression softened slightly. He was dying, Mrs. Whitmore, and you treated him like a human being. Apparently you were the only one who did. He wrote in his final instructions, Elena doesn't see dollar signs. She sees souls. Let her show the world what healthcare built on humanity looks like. The tears came then, hot and unstoppable. Thomas hadn't bought her kindness. Her kindness had been freely given. Expecting nothing, he'd simply recognized it and decided to amplify it beyond anything she'd imagined possible. The lawyers left her with documents, financial advisors, responsibilities that felt crushing. But in the pile of paperwork, she found a handwritten note dated the day before Thomas died. Elena, don't let anyone tell you this is a fairy tale. You earned nothing because kindness cannot be earned. It can only be given. I'm not rescuing you. You rescued me from dying alone and forgotten. This is simply my way of saying thank you. Build something beautiful. Help others the way you helped me. And know that a dying man's last days were filled with dignity because one struggling nurse chose compassion over convenience. That gift is priceless. What I'm leaving you is just money. You already had everything that mattered. T. Elena's mother survived her cancer thanks to treatments they could suddenly afford. The free clinic opened 18 months later in Elena's old neighborhood, staffed by nurses and doctors who understood poverty because they'd lived it. Health Corp's hospitals maintained affordable care pricing, revolutionary in an industry of skyrocketing costs. Sometimes, late at night in her office, Elena looks at the silver band she still wears and thinks about the dying man with kind eyes. She'd married him expecting nothing, wanting only to ease a lonely man's final days. Instead, he'd seen her, truly seen her, and trusted her with the power to reshape thousands of lives. The real gift wasn't the billions. It was the reminder that kindness, offered without expectation or calculation, possesses its own quiet power. Sometimes it simply makes someone's last days bearable, and sometimes, just sometimes, it changes the world.